And we are live. Welcome to another edition of Premier Physical Therapy weekly webinars. I'm just going to see if I posted this to the right page. Just a second. All right, we look good. So today's topic is understanding imaging for your low back. A lot of people get imaging, especially MRIs for their low back, and get really worried or concerned. So we just want to clear up a few things and make sure you understand the results of your imaging. All right, I of course am, my name is Curtis Pachoka. I'm one of the physical therapists that work here. If you haven't seen one of our webinars before, Um, my background is I graduated from UNF with my doctorate of physical therapy in 2015, and I was board certified in orthopedics July of 2020. A little bit about our clinic. Um, Whoops, let me see. Let me get the PowerPoint up. All right, there we go. All right, a little bit about our clinic is it's local PT owned clinic, two locations, one in Jacks Beach, Beach Boulevard and Hodges, and then one in Ponte Vedra in near Fairfield Boulevard, just south of Palm Valley if you're on A1A. Some subspecialties that we have are orthopedics, TMJ and facial pain, lymphedema, and running and golf programs. So, common question that we hear a lot is, don't I need to get imaging before starting physical therapy? Very common question. Imaging is frequently used to determine the cause of low back pain, with findings that include disc degeneration, disc bulging, disc protrusions, and annular fissures. But are these the sources of pain, and how prevalent are these conditions in people without low back pain? So I have this study here, very popular chart. What this article did was they took a group of patients that were asymptomatic, they had no back pain, and they wanted to see how prevalent certain conditions are, findings on their MRIs. So some of the big ones that really stand out, if especially because I hear a lot of people, a lot of patients of mine say this, is I have degenerative discs. They say I have chronic low back pain because I have degenerative discs. Well, if you look at this chart here, if you're 30 years old, you have a 52% chance of having disc degeneration, and these are people without low back pain. So it goes to show you that it's actually normal to have degenerative discs, especially if you're over the age of 30. And it also tells you that they might not be the source of your pain because these are asymptomatic patients that have degenerative discs. As you can see, as you get older, the chances are more and more likely. By the time you're 80, you've almost 100% chance of having disc degeneration. So it's a very common thing to have in your imaging results. Uh, Disc height loss, disc signal loss kind of means that the disc is losing water and maybe shrinking in size. So as you can see, that gets pretty common too as you age. Disc bulging, that's a big one. A lot of people, they hear that they have disc bulging and they just get a lot of fear. They feel like they're crippled. They feel like they can't lift or bend or do anything. And if you look at this chart here, if you're 40 years old, it's 50-50 chance that you're going to have a disc bulge or not. And this is asymptomatic patients. If you don't have back pain, there's a 50% chance you'll still have a disc bulge. And then another real common one is facet degeneration. Another word to call this would be joint arthritis. So this one is a little more rare. It doesn't get to 50% prevalence in patients without back pain. until about 60 years old. So that's one that you would expect to be normal once you're around 60 or older. Now, some conditions that aren't that normal are disc protrusion and spondylolisthesis. Spondylolisthesis is a fracture in your back that a lot of people, especially high level athletes, will have and live with. Not necessarily will cause you any issues. As you can see, these are asymptomatic patients, but this doesn't really get common until you're 80. So, not as common as these other conditions. And then disc protrusion never even reaches the 50% mark. So, if you see that in your MRI, that might be a little bit more something you want to pay attention to. So, imaging in the presence of pain isn't always necessary, but imaging can be a useful adjunct in determining a patient's prognosis. However, imaging can be harmful in the recovery process, creating misleading fear, anxiety, and the belief that activity could further damage your back. Imaging can also lead to medical and surgical interventions that don't resolve the patient's symptoms. This always goes back to that chart. That whole chart was patients without back pain that got imaging done as part of the study. So you wouldn't want to necessarily treat a disc bulge or disc degeneration in someone with back pain because it might not be the source of their pain because it's that common. It's also going to be found in patients without low back pain. So it doesn't seem to be the source of pain or a pain source generator. All right, a different study here. This study took a look of one patient, and that patient went to 10 different MRI centers over a 3-week period. The study participant was a 63-year-old female with low back pain and right sciatica. So you would expect, she goes to 10 different centers in a local area, that they're all going to show the same findings. But there was variability in throughout all 10 MRI results. So not much, each center you went to didn't really agree with the next center. So out of 49 total findings, none of them were unanimously reported in all 10 MRIs. So that's a little scary how none of the 10 MRI centers could agree on one thing. So that goes to show you that you don't really want to rely solely on an MRI because it depends on which center you go to, you can get different results. And it's tough to tell which center had the most accurate results, but none of them were unanimous. So it goes to show you how much variability there is when you go to get an MRI. So, to answer that question, do I need imaging before starting physical therapy? The answer is no. You do not need imaging prior to seeing a physical therapist. And physical therapy can be a good start where your therapist can determine if imaging is necessary with a thorough examination. Imaging should only be used in the presence of progressive neurological symptoms. An example of that, if you're getting bowel and bladder changes, or if you get a foot drop that's getting worse and worse with leg weakness, or red flags being maybe you have a history of cancer, you're suspecting something like that might be going on with your spine, history of trauma, you might have a fracture, then you want to maybe go in and get a MRI. But without those red flags or progressive neurological symptoms, it is very safe to start other interventions before getting an MRI. Here's another question, but there's no harm in getting an MRI just in case, right? Patient usually, to counteract the first question of do I need imaging before going to therapy? If I say no, they'll answer with this question, but there's no harm in getting it just in case, right? Well, you would think there's no harm. but actually, it could actually be harmful to get an MRI, even just in case. So this study here took a look at that. So unnecessary imaging for low back pain can actually do more harm than good and is likely to lead to further disability down the road compared to others who haven't had imaging. In fact, if you have low back pain, it could save you an average of 134 days per episode if of care if you don't get an MRI. So I'll explain that a little bit further, but this was the study. The objective was to determine the effects of early imaging on medical cost and disability. So the population was acute, disabling, work-related low back pain with and without radiculopathy or pain going down your leg. So the background behind this is, as I alluded to earlier, the evidence-based practice recommends conservative treatment for at least 30 days prior to getting an MRI, unless red flags are present. So this study excluded MRIs that were indicated or if MRIs occurred after 30 days. So they only looked at people who got these MRIs that were against this recommendation, against waiting 30 days if they weren't indicated. So this chart might be really hard to see. I tried to highlight some of the important things, but they had two groups, ones that got MRIs early and ones that didn't get the MRIs early. So, and they then separated by regular low back pain and back pain with pain going down the leg. So the ones that did not get an MRI early, the duration of episode was 50 days. And if they did get an MRI early, the duration of episode was 184 days. And then in the other column of patients that had back pain without pain going down their legs, if you got an MRI, if you didn't get an MRI, the duration of care was about 44 days till recovery. And then if you got an MRI, the duration of care of 165 days till recovery. Also, medical costs. If you have radiculopathy, pain going down your leg and low back pain, and you didn't get an MRI, it'd be about $4,000 of healthcare costs. But if you got an early MRI that wasn't indicated, that's $22,000, so a lot more. And then in this other section, without radiculopathy, low back pain, the average costs without an MRI is $2,000, and then with an MRI, it'd be $17,000. So it just costs a lot more days to recovery and a lot more medical cost if you get an MRI early when it's not indicated. A little bit more of explaining that is, it's not the MRI that's harming you necessarily. It's not the radiation or anything that physically that the MRI is doing to you. The MRIs are very safe. It's the psychological effects of looking at your results and thinking that you may be crippled when you're not. If you see the results that we had the chart on earlier, that you see a disc bulge, you see disc degeneration, things of that nature, in your head you buy into that and you feel like you're crippled or you're broken. But that chart I showed you earlier, it's actually normal findings. Those are all normal findings in patients without low back pain. So it's nothing to be afraid of or to think that you're broken or crippled, because those are all just normal findings. So getting an MRI early when it's not indicated, that's how it can do more harm than good, is if you see the findings and you get scared and think you're crippled, and then you're afraid to return back to normal exercise or normal activity. So we always finish our live presentations with a little bit of things that you can do next. So if you have low back pain or you wanted to get imaging done for it, you have some decisions to make. What we would recommend is you don't ignore it, you don't mask it, you want to address it. So ignoring it, you see if it goes away in a month. Masking it, you just take medication, rely on that, or you can address it, which is physical therapy's goal is to determine why you have low back pain in the first place, not just to relieve your symptoms, because that would be masking it. We want to figure out what caused it in the first place and prevent it from happening again. So that's what really separates physical therapy apart from other interventions. So a little bit what we talked about just now, physical therapy is the best way to address the root of your pain, get back to what you enjoy, experiencing lasting results with pain relief. And PT can address the vast majority of low back pain without further intervention needed. We do soft tissue manual therapy, joint manual therapy, stretching, exercises. So it's really the whole package, even cupping, A-stem techniques, dry needling. So whatever you need, it's a pretty all-in-one package that physical therapy offers. So a little bit of what would PT be like, kind of like what I just talked about, all those manual techniques, hands-on. We also want to give you a lot of education on things, you might be doing. You might be sleeping wrong, your posture might be wrong with your sitting at work, or something might be causing your low back pain that just needs to be resolved with some management over some education on that. A couple options. You can come into the clinic for an evaluation. You can do a consultation with telehealth, but please call the clinic to have your insurance benefits run to see if they cover telehealth. Or you can start with the education that we provided in today's webinar and start from there and seeing if that starts to help. This is just some references from the articles. So what I'm gonna do is check the comments section to see if there's any comments. It is Friday, so almost at the weekend here. Let's see. Yeah, I don't see any comments, so I think we're good to go. So thanks again for tuning in and enjoy your weekend.